Welcome to Talk of the Town. Dieesha Hicks has joined us. She is with the Lowcountry Council of Governments, and she will be talking about the Medicare Advantage plan and deadlines and so forth. So Dieesha, Happy New Year. It's great to have you with us in January. And as I was telling you earlier, I really don't understand the difference between regular Medicare, what I have, and the Advantage plan. So you want to just kind of lay all that out for us?
I will. So with the Medicare Advantage plan, a lot of people hear it as Part C. With all the parts, it starts to get a little confusing. But Part C, or Medicare Advantage plan, is your original Medicare. So you have your A, your B in there, as well as most of them have additional benefits that aren't covered by original Medicare, like dental, vision, hearing, and you could find a plan with your prescription drugs included into that plan. What happens is those plans are contracted with Medicare to provide that health insurance coverage for you. It pays like original Medicare, so they pay their 80% and you're responsible for your 20% coinsurance. It kind of acts like when you're working and you have group health insurance. I have to see a doctor in a particular network. You have to pay co-pays and co-insurances. So it kind of mimics that.
All right. And this is, so we're in open enrollment for Medicare Advantage. And so
it is.
Give us more about the deadlines for that to sign up.
So Medicare Advantage open enrollment was started in 2020. It's so that people that are coming off of the regular open enrollment who may have been put into a plan that their doctors aren't in the network or someone scammed them into something, it gave them another opportunity to check their plans. So from January 1st to March 31st is the Medicare Advantage open enrollment. But you have to have a Medicare Advantage open enrollment plan to participate. So you can switch back to a standalone drug plan and go back to original Medicare, or you can switch between Medicare Advantage plans at this time. And so say if you enrolled in January into a new Medicare Advantage plan, it will start the following month.
Right. And so let me kind of clarify again. If you already have Medicare, this is the time you can switch to the Medicare Advantage?
So you have to have a Medicare Advantage plan already to participate in this open enrollment.
Okay.
So you can switch back to original Medicare, but if you have original Medicare, you can't switch to a Medicare Advantage plan, if that makes sense.
Right. Are you finding that more and more people are going to the Medicare Advantage? They're finding that is it less expensive? What is the cost?
It's less expensive on the front end. Some people really want that dental and vision. So a lot of that pushes that towards the Medicare Advantage plan. Some people can't afford that supplemental plan, so they have to kind of stay with the Medicare Advantage plan. Also, we all see the commercials. You may could get this, you may could get that. So it's kind of glitz and glamour for them. So they kind of follow can I get something kind of train? But it just depends on what your personal health goals are, like what you see for your future, how you want your coverage to look.
And that's what you help folks with. So
Right.
They call you or come in and see you, and you can kind of lay it all out. These are your various options. And so you will have an individualized, a personal kind of plan for them that you've thought through and dialogued with that individual to make sure it's the best for them.
So when somebody comes to see me, like, my goal is for them to have a complete understanding of what their health insurance looks like for them in their future and in their present. And so the more you understand, the better you have a chance at picking the best option for you.
Right. And would you say most people really, when they come in, they're confused and really don't understand?
Right. It is. And it's a complicated thing. I think it's the wording, like you got the A, you got the B, you got the C, you got the D, you got the Medigap. Right. So a lot of people are like, I just need A, B, C, D, and whatever else you can get me.
Well, thank you, Dieesha, for everything that you do for our community through the Lowcountry Council of Governments. Dieesha Hicks. for, again, your service and your leadership in this area. Thank you so much, Dieesha, and we'll
Thank
see you
you.
next
And
time.
can I say one more thing before we go?
Sure.
It is also general enrollment period for those who did not enroll in their Medicare when they turned 65. They could do that right now as well, January to March 31st.
Oh, okay. All right. Say that one more time real quick.
So for those of you who missed your initial enrollment period, like when you were turning 65 or when you lost active employee benefits, right now is the time that you could get enrolled in original Medicare from January 1st to March 31st.
To March 31st. All right. Very good. Great information. Thanks, Dieesha. See you next time.
Thank you.
Bye-bye.
Bye-bye.